Hello student, today we will see anatomy of respiratory system. Respiration, the exchange of gases between atmosphere, blood and the cell is called as respiration. So the exchange of gases CO2 and O2, exchange of gases between the atmosphere, blood and the cell is called as respiration. The process is divided into three types. One is pulmonary ventilation, external respiration and internal respiration. Pulmonary ventilation, it is the inspiration and expiration of air between the atmosphere and the lungs. External respiration means exchange of gases between lungs and the blood is the external respiration. Internal respiration is exchange of gases between blood and the cells. It's inside the blood and the cells is from internal respiration. External respiration means lungs and the blood. So that is what external. Pulmonary ventilation means inspiration, inflow and outflow, expiration of air between atmosphere and the lungs. It is a pulmonary ventilation. So we have to keep the definition of pulmonary ventilation, external respiration and the internal respiration. Next are the organs of respiratory system: nose, pharynx, larynx, trachea, bronchi, lungs and alveoli. So these are the organs of associated with respiratory system, and here beside that there is a respiratory system diagram. Respiratory system divided into two parts: upper respiratory tract and lower respiratory tract. Upper respiratory tract contain nose and pharynx, and lower respiratory tract contain larynx, trachea, bronchi and the lungs. So respiratory tract divided into two parts. Next is upper respiratory tract function. Upper respiratory tract function are passage of for air. For it will make a pathway for the air, receptors for the smell, filtration of incoming air. What we inhale the air, it will filter and it will remove a large foreign material from the air. It will make the air moisten and it will make a air warmth. Next is lower respiratory tract function. Lower respiratory tract contain larynx. Larynx will help for the sound production. Next is trachea. Trachea will make a passageway for the air from the lungs. Bronchi transport air from a trachea to lungs. Lungs, they will transport air to alveoli for a gas exchange. So these are the functions of lower respiratory tract. Next is the respiratory system function. Respiratory system do a gas exchange, regulation of blood pH, sound production, olfaction, thermoregulation and protection. Gas exchange, oxygen enter to the blood and carbon dioxide leaves the blood. So it will do the gas exchange. Next is regulation of blood pH, altered by changing blood CO2 level by carbonic acid buffer systems. In your second sems BSc nursing, you will learn the buffer systems. In that it will alter by changing blood CO2 level by carbonic acid buffer. Sound product, movement of air through vocal folds. We have a vocal folds. Momentum of vocal folds will produce a sound and the speech. Olfaction, smell receptors are located into nose. So into the nose there are the smell receptors are present that will help for the sensation. Next is thermoregulation, heating and cooling of the body. Our respiratory system do our body, when it is extreme cold our body will keep a heat. When it is extreme hot, body will be cold. It is done by our respiratory system. Next is protection. It will against the microorganism by preventing entry and removing them. MO is nothing but microorganism. Protection from foreign bodies. Next is nose. Nose or nasal cavity, it's the external portion of respiratory system. External portion, we can see nose, it is external only. It open through nostril. There are two holes, they are called as nostril. It is divided into right and left portion, and there is a biseptum. You can see there is middle one is there divided into two nostril, that is also called as septum. It is made up of cartilage, bone, muscle and the skin. The middle septum is made up of cartilage, bone, muscle and the skin. Nasal cavity is hollow. It is hollow. There are air and the mucous membrane are present. The nose lined by ciliated columnar epithelial cell contain mucus secreting goblet cells. So the ciliated columnar epithelial cell, it will secrete the goblet cells for secretion of mucus. Functions of nose: act as passageway of air. We know a nose act as passageway of air. It will moisten and warm and filter the air. It will help for sense olfactory receptors located in the nose, help for sense of smell. Next is pharynx, also called as throat. It's a funnel-shaped tube. About it is 13 centimeter long. Pharynx is 13 centimeter long. It is also called as throat. It is common passage for digestive and respiratory system. Pharynx is for both digestive system and the respiratory system. It extends from internal nares to larynx. From internal nares to larynx, it will be extended, and its wall is composed of skeletal muscle and lined with a mucous membrane. Pharynx lines with the skeletal muscles and a mucous membrane. Its wall made up of that only. So it's about the pharynx. Next is division of pharynx. Pharynx is divided into three parts. As we know, pharynx is divided into three parts. One is nasopharynx, oropharynx, and laryngopharynx. Nasopharynx, its uppermost part of pharynx, lies backside of the nasal cavity. Oropharynx is a middle part of pharynx, lies backside of the oral cavity. Its pharynx upper part is nasopharynx, middle part is oropharynx, and the lowest portion is laryngopharynx. It lies just above the larynx. Next is functions of larynx. It pathway for air and food. Common organ, it is involved in both respiratory system and digestive system. Air and food enter from the nasal and the oral section into the pharynx. From nasal and the oral section, food enter further from mouth to pharynx. Air enter from nose to pharynx. It's a common passage. It makes the air with humidify and warmth. The air further warmed and moistened, it is passed through the pharynx. It contains the olfactory receptor has sensed for the taste located in the pharynx. Protection from lymphatic tissue from tonsils produced by antibodies. Foreign bodies are prevented by pharynx only. So pharynx also plays important role in speech by acting resonating chamber for the sound. It creates the resonance in the chamber, and the our speech will come out. So it's a function of pharynx. Next is larynx, also called as voice box. Larynx is called as voice box. It's short passage that connect the pharynx with the trachea. It is a short passage. It connects the larynx with the trachea. Between the pharynx and the trachea, there is a larynx is present. It's irregular shaped. Cartilages are present. There are three type of cartilage. One is thyroid cartilage, and second one is cricoid cartilage, and another one is arytenoid cartilage. So these are both three are hyaline cartilage. Thyroid cartilage, cricoid cartilage, arytenoid cartilage, both three are a hyaline cartilage, and epiglottis is present. Elastic cartilages is present. So it is made up of larynx is made up of all these three hyaline cartilage and one epiglottis, that is elastic cartilage. So next is this is a structure of larynx. So above there is epiglottis is present. Next to epiglottis there is hyoid bone is present. Next to that is thyroid membrane is present. Next is thyroid cartilage, cricothyroid muscles are present, cricothyroid cartilage, trachea, cricothyroid ligaments are present. The anterior view of the larynx, you can see how anteriorly it is looking. Next is posterior view of larynx. Backside, this is larynx, how it looks. So thyroid cartilage is also called as Adam's apple. It consists of two fused plates of hyaline cartilage that forms anterior wall of larynx, gives its triangular shape. So when you see the thyroid cartilage, when it is there are two plates of your hyaline cartilage are fusing, so it is giving the look of triangular shape. So it's a large in females and men. When you see the in the throat religion, the boys have a triangular shape, bulged shape from the throat, that is called as Adam's apples. It is more in men. There is a next is cricoid cartilage. This is below the thyroid cartilage. Below the thyroid cartilage there is a cricoid cartilage. So there are the ring of cartilage. First ring of cartilage of trachea cartilage, cricoid cartilage is attached. I will show you the diagram how it is attached in next. When you see this diagram, the thyroid cartilage is above and cricoid cartilage is below. Whereas aretinide cartilage, these are made up of hyaline cartilage located posterior to the thyroid cartilage. Backside of the thyroid cartilage there is aretinide cartilage. They provide attachment to the vocal cords. Aretinide cartilage are attached to a vocal cords. Next is epiglottis. It's a leaf shaped piece of elastic cartilage. Epiglottis is a cartilage. It is leafy shaped. It is elastic. The stem of epiglottis is attached to thyroid cartilage. It is attached to thyroid. Stem is attached to thyroid cartilage, and leaf portion is unattached and free to open and close like a trap door. So it open and close the leaf like structure. It is functions of larynx. It help for the production of sound, protection of lower respiratory tract during the foreign materials. When we inhale the foreign materials, it give the protection of the lower respiratory tract. During swallowing, what happen, our larynx will move upward and open the pharynx, and epiglottis will close the larynx. Larynx moves upward, epiglottis will close the larynx, and pharynx open, and the food will passes into the esophagus, not the lower respiratory tract. The food should not go to the lower respiratory tract. It can cause the diseases. Next is passage for airway. Function of larynx is it will help for the airway. It will make a passageway, it will humidify, it will filter, and it will make the air warmth. It produces a humidification, filtration, and warming of the air. It travel through the larynx. When it travel through the larynx, air become humidified. How the voice production. Vocal cords are present. There are two folds of mucous membrane. Vocal cords are the two folds of mucous membrane with the thyroid cartilage anteriorly and aretinide cartilage posteriorly. There are two folds of mucous membrane. One is thyroid cartilage anteriorly, it is front, and backside it is aretinide cartilage. When the mucus controlling the muscle controlling the vocal cords are relaxed, the vocal cords open and passageway of air through the larynx is clear. The vocal cords are called as abducted. Abducted means open vocal cords. When the muscle controlling our vocal cords, they will relax, they will open, and the air will be entered through the larynx. It will clear, and the vocal cords are abducted. Air will trap there. The speech of sound produced by vibrating vocal cord is low. When we vibrate the vocal cord, our speech is produced. When the muscle controlling the vocal cord, they will contract, and the vocal cords close, and the vocal cord are now it is called as adducted. When it is opening, it is called as abducted, and it is when it's closed, is called as adducted. Voice production. The pitch of sound produced by vocal cord is high. So when we scream loud, the pitch is there, it is produced very high. The pitch of voice is determined the tension applied. How you apply tension, that much the pitch will high to the vocal cord through appropriate set of muscle. Higher sound result by increasing the tension of the vocal. As I told you, when the tension increases, the pitch increases, the high sound will come. Lower the sound, decrease in the tension and the vocal cords. When the vocal cords are abducted, no sound will come. When they are adducted, the vocal cord produces sound. So when abducted, no sound. When it's adducted, sound will come. So keep the mind the differences. Next is trachea, also called as windpipe. It's a tubular passageway of air. Air. It's 12 centimeter long and 2.5 centimeter in diameter. It extends from larynx to fifth thoracic vertebrae. Where it divided into left and right pulmonary bronchi. So trachea will divide into left and right primary bronchi, and it extends from larynx to fifth thoracic vertebrae. It is located in front of the esophagus, and it has a C-shaped. Trachea is C-shaped cartilaginous ring within the wall. It has C-shaped cartilaginous ring within the wall. It is made up of 4 layers. One is adventitia, hyaline cartilage, submucosa, and mucosa. So the trachea is made up of 4 layers: adventitia, hyaline cartilage, submucosa and mucosa. So this is the diagram of trachea. Larynx is present, then neck trachea, and trachea is divided into primary and secondary bronchi. On the other side, you can see the C-shaped cartilaginous rings of trachea. Next is function of trachea: warming and humidifying and filtering the air. It produces humidification, filtration and warming the air. Travels through the trachea. It contains C-shaped cartilage ring. It will give the support to the trachea. It contains the mucocellular excavators. Mucus secreted by goblet cells moisten the air and trap the dust particles. So these are the mucociliary escalator. They secrete a goblet cell. Goblets will moisten the air and it will trap the dust from the air particles. Next, cuff reflex. A nerve ending in the trachea are sensitive to irritation, produces cuff. So at the nerve ending of the bronchi and the trachea, it is very sensitive part, and any substance will trap there. There may be irritation, and irritation causes and cough production may happen. There are two lungs lying on each side of the midline. On the midline, think it, at the chest there is a midline. At the two sides there are two lungs are present. They are cone shaped organ. They are separated each other by the heart. By heart, the lungs are separated by the heart and present in the thoracic cavity. Lungs are present in the thoracic cavity. The lungs are divided into apex, base, costal surface and medial surface. So the lung is divided into 4: apex, base, costal surface and medial surface, and it is divided by the heart. Next is the apex is narrow superior. At the above there is the apex. At the below there is a broad portion. Costal surface of the lungs lying against the ribs. Against the ribs there are the surface that is called as costal surface. It contains a religious called as hilus, through which the bronchi, pulmonary blood vessels, lymphatic vessels and nerve enter and exist. I will show the where is a medial surface. It contains a religion called as hilus. From hilus, bronchi, pulmonary blood vessels, lymphatic vessels and nerve enters and exit from hilus. So there are apex at the superior, base at the inferior, costal surface is against the ribs, and the medial surface contain hilus, where the bronchi, pulmonary blood vessels, lymphatic vessels and nerve enter and exit. So this is the structure of lungs. You can see at the superior, inferior, and there are lobes are present: trachea, pleural, left lobe, alveoli are there, diaphragm is there, pleural fluid is present. So this is the diagram of the lungs. Next we will see the pleura and pleural cavities. The outer surface of each lung is covered by serous membrane called as pleura. So the lung's outer cavity, there is a serous membrane is present where it is called as pleura, and pleura is divided into two. One is visceral pleura and parietal pleura. So space between these two pleura is called as pleural cavity. The pleural membrane produces a pleural fluid. Pleural membrane produces pleural fluidity that circulate in the pleural cavity, act as a lubricant, ensuring the minimal friction of lungs during breathing. During breathing, there is lungs are going up and down, so there is a friction. To prevent this will help. Next is lobes of lung. So the right lung is divided into 3 lobes: superior lobe, middle lobe and inferior lobe. At the right side of the lung is divided into 3 lobes. The left lung is subdivided into 2 lobes. One is superior lobe and inferior lobe. The right lung is thicker and broader than the left lung. So right lung is thicker and broader than the left lung. So these are the lobes of lung. At the right side there is a superior lobe, middle lobe and inferior lobe. At the left side there is a superior lobe and inferior lobe. So right side lung is very big than the left lung because of it contains 3 parts. Next is fissures of lung. Right lung has 2 fissures. One is oblique fissures, horizontal fissures. Left lung has 1 fissure, oblique fissure. It separates a superior lobe and inferior lobe. So fissures are present. Right lung has two fissures and left lung has one fissures. So oblique fissures and horizontal fissures. Oblique fissures in left lung. It separates superior lobe and inferior lobe. So this is a fissures diagram of lungs. At the left side there is only one fissure, that is oblique fissures, and at the right side there are two. One is horizontal fissure and the other one is oblique fissures. So next is bronchi. At the carine point, the trachea divided into right pulmonary bronchus and the right lung for a right lung and left pulmonary bronchus of the left lung. So bronchi. After when the trachea is divided into primary bronchi and secondary bronchi, bronchi divided into right pulmonary bronchus at the right side. Next, left pulmonary bronchus of left lung. Right bronchus, it is wider and shorter than left bronchus. From left bronchus, right bronchus is wider and shorter. It is 2.5 centimeter long. After entering it right lung, primary bronchi is divided into three secondary bronchi. So after in the right lung, primary bronchi, when it enter, divided into three secondary bronchi as one of each lobe of the lung. One for each lobe of the lung, it will divide. Next, left bronchus, it says 5 centimeter long. It is narrow than the right bronchus. It is very narrow. After entering the lung, left primary bronchi divided into two secondary bronchi, one for the each lobe of the lung. Next is the secondary bronchi, further divided into tertiary bronchi. It is divided into bronchioles. When the secondary bronchi divided into tertiary bronchi, next it is into bronchioles. Bronchioles are further divided into structure called as terminal bronchioles. Bronchioles are further divided into terminal bronchioles. Terminal bronchioles are further divided into respiratory bronchioles. So after secondary bronchi divided into tertiary bronchi and divided into bronchioles. Bronchioles structure, tube-like structure called as terminal bronchioles. Terminal bronchioles divided into respiratory bronchioles. So in this diagram you can see a primary bronchi and bronchioles, secondary bronchi, other further divided into tertiary bronchi, bronchioles, you can see. Next is lobules. Each lobe of lung is divided into many small compartments called as lobules. Lobe is divided into many compartments called as lobules. Each lobule contains lymphatic vessels, arteriole, a venule, and a branch from a terminal bronchiole. Terminal bronchiole and subdivided into small branches called as respiratory bronchiole. Terminal bronchiole divided into respiratory bronchiole. Respiratory bronchiole again divided into 2 to 11 alveolar ducts. These ducts are surrounded by alveoli and alveoli sacs. So alveolar duct is surrounded by alveoli and alveoli sac. The alveoli are a cup-shaped structure. Alveoli cup-shaped structure and surrounded by capillary networks. So you can see a lobe divided into small compartment called as lobules. Lobules have a containers, lymphatic vessels, arteriole, venule, and a branch of terminal bronchioles. Again, terminal bronchiole are subdivided into small branches called as respiratory bronchiole. Respiratory bronchiole again subdivided into 2 to 11 alveolar ducts. So the alveolar duct surrounded by alveoli and alveoli sac. Alveoli are cup-shaped in structure. They are surrounded by capillary network. Next are the alveolar wall consisting of two types of cell. Alveolar wall has two type of cell. Type 1 cell is a lining of the alveolar wall. The type 1 alveolar cell, they are in the lining of the alveolar wall. Second, it secrete alveolar fluid. It's a mixture of phospholipids and lipoproteins. Alveolar fluid, it's a mixture of phospholipids and lipoproteins which keep the alveolar cell moist. So these alveolar fluid keep the alveolar cells moist. So this is the respiratory T division. First primary bronchi into secondary bronchi, secondary into tertiary bronchi, next terminal bronchioles, respiratory bronchioles, alveolar duct, alveoli, alveolar sac. So this is a respiratory T division. You can keep this much only, you can write explanation much better. Thank you for watching this video and please subscribe for more such videos.